All, this is Dr. Mobeen Sayed from drBeen.com. Welcome to one more show. This is our third show for today. This is our chit chat, so my favorite part. Algebra Bean, Loreen says, Eid Mubarak to those who celebrate. Thank you very much. Eid Mubarak back to you as well. And that brings me to the quick announcement as well. So tomorrow, day after, and half of the day after that day is Eid. So with your permission, I will take tomorrow morning and day after morning off, because morning time is when more of the Eid activities occur. We will have the discussion tomorrow evening. I think I want to talk about the black fungus in India. With that, we'll do some chit chat as well. Today is the Eid evening, Eid Eve. So I would keep my chit chat a little short so that I can join the family for their preparations. And if then possible, maybe I'll take Friday off. So if that seems okay, then we can use that as a plan. So let's start our discussion as well. Arun Mehta says, so those cell or alveoli will die. So if 80% lungs are damaged, 2DG will deprive lung tissue and irreversibly damage lung tissue. No. So if I go back to the good question, the answer is no. Let me just quickly share the screen. So if you see here, when I drew this cell here, I did not make it dead. The reason for that, if that is sufficient, because I did not make it dead, they will not die. The reason is the following. We are taking other food as well all the time. So this is just a tiny sachet. So imagine you eat food, normal, regular food, and there is tiny amount of glucose that we have taken, which is fake glucose. Now, the rest of the body and these cells, all of the cells are going to receive some part of the fake glucose and some real glucose. However, those cells that are most active, they are usually the tumor cells, or they are usually the infected cells, because inside the infected cells are the bacteria, or mostly the viruses, or fungi can also be there, and they're sitting in there and they're just doing their function and they're making more viruses, and the cell is just running at its full speed. And those cells are pulling glucose at a warp speed as well. So most chances of a higher concentration for fake glucose is going to be for those cells. Now, these cells are going to get normal glucose as well, but they would get a higher concentration of bad glucose as well. So they would stall in their function, not die. Now, having said that, this is a point of testing the drugs and their dosages. If you give too much of a dose, for example, replace all the glucose that is going to come from the food with this sachet, then the person would have lots of cells that are going to start dying. So the safety, efficacy, and dosage studies in trials, their purpose is to figure out where can we keep the cells safe from dying while stall, slow down, or kill the viruses and their production. So here, this one would actually reduce the viral production. And that would then help immune system to quickly kill these viruses off as well. And so the virus will be gone within 2-3 days, ideally. So good question, Arun. Kevin Braza says 2DG versus Ivermectin on effectiveness and safety. So I would believe that the safety is similar, but 2DG is not given in the prophylaxis or not given in the early part. And the reason is very simple. 2DG's function will occur when the factories are running fast. And the factories are not running fast in the beginning of the infection. Because of that, 2DG's usage would only just reduce the remaining cells' function and not really stop the cells that are going to start running fast. So in the beginning, it is of less usage compared to ivermectin, which is very useful in the beginning as well. Its main usage becomes beneficial when the cells are really running fast, when the race cars are going at their full speed. That is when they are burning a lot of fuel, and this can go into them and stall them, which would then slow them down, which would allow the immune system to catch up, which would allow the virus to be cleared out. So quite different from ivermectin. It has a very specific duration during which it would work, and that is mild to moderate. It is not going to work very well for prophylaxis. For example, if I take it for prophylaxis, it would just keep my cells at a lower level of function, and I would feel tired, or I will feel less focused, less concentration, less able to do things. And that is not what we need. And ivermectin doesn't do that. So very different mechanisms. Tammy Smith says, have you heard of an increase in mononucleosis after COVID infection? We talked about it when Dr. Bruce Patterson had joined us, and we talked about the long haulers. At that time, he had mentioned that, hey, when infections occur, immune system becomes busy, immune system is reduced in its capacity, in its scale as well. And because of that, opportunistic infections would take hold, including mono. Kamran Jamil says, question, what if healthy cell get this fake glucose? Won't it hurt the normal cells too? So once again, imagine there is a healthy cell and compare this with this cell. This is an infected cell. And here we have a normal little healthy cell. Let me remove the question from here. So this one down here is a little cute healthy cell, and this cell is just doing its own little function. Now the difference between them is this, that this cell is really operating at a very low threshold compared to this cell, which has really bad factories running in it all the time. So now let's say we have the fake material. That material is going to be sucked into this one more than here. So this healthy cell would get some fake molecules as well. But then what? It would get majority of good glucose, and it would still be okay. This guy is just pulling in so much glucose, which is not really just for the cell. It is the viruses that are running the machinery. And that is when the glucose would actually become very difficult for the cell to maintain the good quality of it, good concentration. This is the same thing with the cancer cells too. They are just operating at a very higher level. And so we give things that can disrupt their operation, but the rest of the cells are just fine. Okay, so this is that discussion. Thank you. Let's look at the next question. So Nick, I saw a comment from Nick and it just passed. So one second. It was a good comment, so I'm gonna go find it and show it to the cool beans. So Nick, I'm trying to find your comment. Oh, there. I just saw it. 1 second. Here. So Nick says, I'm sorry, Dr. Bean, but this idea of interfering with the metabolic machinery in such general and fundamental way is concerning to me. I agree with that, that the the glucose, especially for the cells. So for example, if I object on this drug, although they did the clinical trials, they've seen it works and they are going to use it. If I object to this drug, I would say, look, not only just the virus infected cells are working fast, the immune cells are functioning at a higher capacity as well, because they need to take care of the virus. So if they are also going to get bad glucose in them, then maybe they are not going to be working correctly. Now I'm going to flip the statement in and give a contra point, and that would be the point of testing and trialing is to figure out, is it safe or not. So far they're seeing that this is fine, so they're using it, but your point is correct. Okay, so continuing. James Crook says, hi, Dr. Bean and Well Beans for Bean on Sunshine Coast, British Columbia. Will Luffy do another cameo walkthrough? Let's see. Luffy was here a few minutes ago. I'll see if I can get him in. He is just a celebrity. So Vivian says, since my J&J vaccine a month ago, I have body aches and fast heartbeat. Doctor did EKG, blood test, all fine. Any suggestion to feel better? So Vivian, my wife as well. So she took J&J about a month ago now, or a little more than that. And she has her joint pains have resurfaced. And I can actually understand that the antibodies are continuing to build up. And that means that the inflammatory process is continuing. And it has become so bad now. So just in last 2-3 days that she is once again walking like stick legs, that she cannot bend her knee joints easily. And so she reached out to the doctor, did the blood workup. Her CRP is normal, her ferritin levels are normal, all blood workups came back normal. The only thing that is not worked up, and I don't think that there are many labs that are doing it, are the COVID antibody related antibody levels and the inflammatory titers related to them. So now she has to, in my opinion, she would recover in another month time. These antibody levels would continue to go up, then they would start going down, and then the patient would start feeling better. The important thing is, during this time, we have to prevent tissue damage, because the inflammation, the joint pain that is occurring means there is inflammation there. Inflammation means there is tissue damage that is happening. So for that, anti-inflammatories and other modulators will be needed. So same message for you as well. I cannot advise you personally, but I can just tell you that for my wife too, she needs to take medicines that would symptomatically continue to help her, so that tissue damages do not occur while antibodies go up and then they go down. And this particular issue, the fast heart rate, is also seen with the COVID itself in the long haulers. So it is interesting that J&J vaccine has caused this kind of symptom set that is seen with COVID as well. So to me, that seems to be, and this is total hypothesis, I may be wrong. To me, it seems like the virus. In both cases, COVID itself is a virus, and J&J is a virus as well, adenovirus. So to me, it seems like something to do with the virus and our body's response to it. So Denise TG crazy. Okay, so Doug says 2DG should only work in viral phase, but approved for moderate and severe only. So that is a very, very important question. So I think that they are saying moderate to severe where the oxygen dependence is increasing. So I believe that that is still a time of the viral phase. I do not believe in this, and I know that I am contra when I say this to some of my good guests that I respect a lot, to say that within 7 days the virus would be gone. That is not going to happen. Our body would start reducing the density of the virus as much as it can. We would start feeling better because the symptoms have reduced, because the damage has reduced, and then the virus is still being cleared out. So I think in this case, it is interesting that whatever inflammatory, maybe, Doug, maybe it is not just the reduction of the viral. They actually said that we are on the Wikipedia site, they said that there are so many of the actions of this drug that we have no idea what is happening. This is just our hypothesis. So imagine this. So now hypothesis. Even in the inflammatory state, when the body is overreacting to something and just destroying the tissue and causing oxygen issues, there are some cells that are going mad. So maybe they are not virus-laden cells. Maybe they are just immune cells that are mad. And then giving this drug would, whatever is the active cell, it is going to suppress their activity. And that is what makes people feel better. So very, very important observation here. And I was thinking about that as well. And I usually try that I do not just keep adding my opinions. I don't want to make it Mobeen opinion show. This is more of an informational area where I present what I saw. But yes, this actually could be that there are less viruses and more immune cells, and they are going mad, and this is actually slowing them down as well. John Snyder says, thank you, and thank you for the super chat as well. Kevin Braza says, antibodies are dangerous. Not really, Kevin. because we are producing antibodies all the time to combat the viruses and bacteria and the fungi and the other bad things that happen to us. Without antibodies, survival is very, very difficult. The problem is that with extra antibodies, we get inflammation as well. It is a function of the antibodies. We have never actually talked about this, that what is really the functions of antibodies. And I have been implying that you know. So, and majority of you know. So just to be on the same page, let's say this is an antibody. Antibody has multiple functions. One function of the antibody is to bind with the antigen to neutralize it. When it binds, for example, let's say Luffy is running around and just biting. If we can then wrap Luffy in a towel, which once we had to do, then the Luffy will not bite. So similarly here, we have neutralized an antigen by binding with it. Example, let's say in the mucous membrane, when there is an antigen and there is immunoglobulin A and that binds with it, it kind of neutralizes that antigen from progressing further towards the cells. Then antibody binding. So let's say here is a bacteria. And when the antibody binds to its surface, it has marked this bacteria for destruction. And when the antibodies coat, so before just the marking for the destruction, when the antibodies coat this bacteria, the bacteria cannot really attach with the cells and cannot enter them or virus. And so it kind of, once again, neutralizes them. In addition to this, when antibodies bind like this, the constant region of the antibody starts the complement activation, which would in turn activate the inflammatory system or immune systems. And immune system here, when that would be activated, it would try to kill this pathogen. And if there is one bacteria here, there are going to be many other bacteria here as well, because this may be the area of the infection. And so when the inflammation would occur here, an immune system would attack here, they would clear many bacteria. This is another function. Then antibodies can actually bind with a pathogen, and then just this complex of antibody and antigen is just free floating, and then some macrophage is going to pick them up and engulf them and eat them up and phagocytose them and then destroy this pathogen. So they act as a marker as well to destroy the pathogens by getting them phagocytosed. We also know that they can attach to mast cells, and they are helpful for releasing histamine, which in most cases just causes allergies in us. Antibodies are present on the surface of B cells, IgD. IgD are present on the surface of B cell, where they act as receptors for the antigens. Antibody, as I said, activates the complement system as well, which in turn also creates a component called C3b, which is necessary for phagocytosis as well. So antibodies have so many important functions to help our body at all times. And those people who cannot make good antibodies or correct volumes, they have lots of issues. But you are correct if I now kind of take your question and take it to this direction, that these extra antibodies that are being produced at this time, let's say my wife, they are causing inflammatory reaction, and that is causing damage. So I'll agree to that part. So testing 2741 says, question, Dr. Bean, could it not be the spike proteins themselves causing her joint inflammation? So I have done this discussion many times, and this is a very common misunderstanding. It has been propagated. I know when it started, and I actually talked about it at that time, but it has gotten hold. It has gotten hold by my anti-vaxxer friends, who feel that this is a good mechanism to display, to say this is why we should not take vaccines. The mechanism itself is wrong. Here is why. What we are expecting is, and I'm going to try to stay brief in this one because yesterday I went long. When a cell makes the spike protein because of the vaccine, The spike protein is not going to be released in the blood. The cells are not factories of making and releasing spike protein in the blood. That's not, cells are not hormone producing things, and the spike proteins are not hormones. So cells cannot just make, remember the glucose that went into the cell, and the cell attached a phosphate to it, and now the glucose cannot get out. How can we expect such a big spike protein to just get out? It will not get out. Inside the cell, it would be trashed and it would be thrashed and it would be chopped up into smaller pieces, loaded on MSC1 or 2 and displayed. And I almost repeat it almost daily, that if for some reason this cell is killed, many reasons for it to be killed. For example, some NK cell comes here, says, hey, you are presenting some antigens, looks like you're sick, I'm going to kill you. Or, so that should be cytotoxic T cell, not an NK cell. NK cell looks at the MHC complex densities and says, okay, I'm going to kill you. Some cytotoxic T cell kills it, and so on. And let's say the cell is killed, and that causes some spike proteins to kind of spill out. These spike proteins that have spilled out will be immediately picked up by macrophages and dendritic cells and neutrophils, and they would pick them up and chop them up and destroy them. So for a spike protein to find a way to get out in big volumes and then enter the vascular system, from there to float all the way to the joints, and then to be able to be released from the blood vessel into the joint space, and then attach there, then cause inflammation there, then cause destruction there, that is a very, very difficult phenomena to produce. Even the virus itself will need to do a lot of damage to reach that point of going and causing joint pains. So hopefully that clarifies it. Rizobit says, have you done a video on molnupiravir versus ivermectin? If not, can you please? So I have done a video on molnupiravir. I know why you're asking. I haven't done a video for comparison, and this request that you have, Rizobit, is something that would get my channel closed. And for the cool beans here who are not on the joke right now, I know that your question is not a joke. Molnupiravir, I think it is by Merck, and it is a drug that has a functionality of disrupting RDRP of the SARS-CoV-2. So this is sort of a virostatic drug that they are saying that, hey, we want to start selling it. And they're working to get it approved, and the trial is happening. Ivermectin has, one of the mechanism of ivermectin is to stall the RDRP as well. So pick up ivermectin and just package it into something else, maybe change it a tiny bit, and you got another drug. And now there is no taboo attached with it that it is ivermectin. You have named it differently, plus now you can put a cost of, let's say, $2,000 on it, and all of a sudden there is a new drug. So that is the basic underlying thing that I kind of laughed about. So there are such drugs that are coming out. So Rizobits, I have not done it. I can do it. Maybe I'll put it on my other channel, which I am a little more okay with if that channel gets closed down. Colin Hammill says, is there a possibility that people are getting treated for the wrong thing? Perhaps ivermectin works so well as it is a broad spectrum, whereas vaccines are targeted. So vaccines are working as well. I mean, Colin, in this here, if you said that, hey, there is just a general other drugs, let's say remdesivir, maybe targeting something else, and ivermectin is more broader spectrum from that. Or I won't call it broad spectrum, because broad spectrum means antiviral broad spectrum or antibacterial broad spectrum. It is not that. But it has many, many functions in it, which are in different directions. So if we compare it to remdesivir, ivermectin is superior. The vaccine has its own effect, and that effect is also very useful. So ivermectin or vaccine, I don't think there is a good comparison. Ivermectin has its own protection, better than remdesivir's. Vaccine has its own protection. But if I try to pick up your question that is vaccine targeting something else. No, they both are working for SARS-CoV-2. Ahsan Bhutta says, should I get sinopharm vaccine? That is a question for you. I had done a talk about sinopharm, and I thought sinopharm is a good vaccine. I like that vaccine. Art Patron Forever says, nobody can say if molnupiravir is any good. We'll need more evidence for next 5 years. But Art Patron, so here's a deal. They're already in trials. And that means they would soon have approval. Liza says, so right, not in this channel. Thank you very much. Good day. Sharma says, Eid Mubarak. Thank you very much. Eid Mubarak to you as well. Dog Mother says, Ivor okay and MS patients on the Sabri. In MS patients? So Ivermectin is okay actually for MS patients or autoimmune disease patients. Actually, it would be helpful. Eric Dog says, Dr. Bean just volunteered to lecture penguins by a parka. Yes, so I would lecture penguins too. So when I started teaching, in the beginning, I didn't have many students. So one day we just have 1 or 2 students, and one of them said, it looks like you don't have many students. And I said, even if you two were not here and just the chairs were here, I would teach these chairs as well. So I would teach anyone. Once there was a corporation here who had invited me for some lectures on diabetes. And when I went there, they became so surprised that anyone in that organization, thousands of people, they knew that I'm there to teach. I'm a doctor and I'm there to teach medicine, and they were engineers. Anyone who would say anything about medicine, I would just stop there and start talking about it. So then the person who was coordinating my talks said that you are very passionate about doing this. And I said, yes, if I'm standing on a curbside and somebody says, talk about this, I will start discussing it. So penguins are fine. So let's see more. Liza says, for how long 2DG should be maintained in the body? Which tests will tell doctors how is it working on patients? So clinical recovery is what is needed. And then I think there is a frequency that they would have. I'm sure that they have it. I have not seen their document. I can't find it. So in the document, I'm sure that they have that this much is the drug and this is the frequency. Rajiv says, question on 2DG, all cells in the body need glucose. Is this not going to affect all cells? So very good question. I just kind of discussed that a few minutes ago as well. So what happens is, where is the, so here, so imagine this is a normal regular cell, and this is a virus infected cell or a tumor cell. The virus infected cell or tumor cell would be working and operating at a warp speed, very hot. It is running fast. And so it is sucking in a lots of glucose. And so it is getting in relatively higher amount of glucose, including 2DG. On the other hand, normal cells, regular cells, are not working that fast. They're just slowly functioning. And they would also get normal glucose and some of these molecules. So they would not mind if some part of their function is not doing, because they're already just working at a very low level. They already have their ATP. They already are fine. It is the cells that are working too much that would get in trouble. So Khushali Parikh says, WHO statement is adversely affecting ivermectin use in India. What should we do to convince the authorities? So luckily, many of your states and authorities are convinced. For example, Goa, for example, Uttar Pradesh. I believe that many states, many authorities, many local hospitals, many doctors are using ivermectin, and the usage is only increasing. WHO has done a bad job. They did that. So I thought, and maybe I'm just too naive, age has not taught me much. I thought that when WHO said about ivermectin that this is not useful, and people reacted, people like us, people like FLCC, and the world reacted and said, you're wrong, maybe WHO would just calm down and say, you know what, leave this alone, this is hot. But their tweet again after Goa said to use ivermectin in 18 years and over, and WHO tweeting that this is not safe, and then the safety outside of the clinical trial, it should not be used, that then tells me there is an intention to counter these things. So that damage that they have done, I do not know what is the right answer to reduce that damage other than continuing to push. I am pushing every day. FLCCC is doing it. Everyone who can do it, they are doing this work. And I think that is what would really work. Unfortunately, and I'll give you another example, the Surgisphere study about hydroxychloroquine. That study was picked up by WHO as well, and based on that, they stopped hydroxy's use, and then they resumed the use and they stopped the use again, which caused so much of the muddying of the water. So it seems like it is just easy to hold WHO from the nose and just take them wherever you want. You just need to have the right way to influence them. And that an organization of this size and scale and responsibility should be better than what they're doing. So I think I didn't answer your question. I just ranted. The question is, we just keep pushing. We just keep doing it. Show them the videos, show them the FLCCC, show them my videos. There are many times doctors are actually not aware of the mechanism of action. They have the same belief that some general public, majority of the general public, and that is, this is an antiparasitic drug. Why would it work on a virus? So show them my mechanism of action. I think in the people who have been talking about it, I am the only one who have pulled together all mechanism of actions and put them in one place, and hopefully in a cartoony way so that can be understood as well. Show them that 10 minutes video on my other channel, and that can be very useful. I see that some doctors and healthcare workers, when they see the mechanism of action and there are references to them to say, you can go check it out by yourself, then they feel a little bit more compelled. Kevin Brazda says, people who have antibodies but not the vaccine, like me who has gotten sick with the long haul, versus people who get the vaccine, will there be a difference between the people who get vaccine versus antibodies? So look, for example, I'll use my wife's example again. As much as she prefers to be very private and not be outside, I had requested her specially to give me permission to talk about her. Otherwise, she doesn't even put her pictures up. So in her case, for example, she has antibodies and now she has inflammations. In theory, this should go away in another month or so, because that is how the vaccine has poked the immune system. My hope is that vaccine-generated antibodies or immune system response will not become dysregulated into a long haul. I am still kind of thoughtful about it and I'm observing, but for the long haul with the infection, that is a problem that I was talking with a young boy this morning, very healthy, very intelligent, bright young man, and he is suffering from long haul for a year now. So I think vaccines will not produce that kind of an effect just because. So somebody is going to challenge me and say, you are just pro-vaccine and that's why you're saying it. No, the vaccines are not replicating. They would not increase in quantity and continue to cause the immune system to be poked. Because of that, vaccines are different from the virus itself. So David, correct. So that was a different study in UK, and there was a study on hydroxychloroquine in Brazil as well. where they instead of giving hydroxychloroquine, they gave chloroquine, which is 5 times more potent, and then very high doses of chloroquine, which then caused people to have severe side effects, and they had to stop the study. So there were incorrect doses done. But the biggest damage was done by Sergi Sphere, who came up and said, we have looked at the data from 110,000 people and so many hospitals, and we have found out there is no effect. When they were asked to show how did they do it, and the hospitals, they claimed that we had pulled the data from, hospitals said no, we did not work with them. They just, I do not know what they did. But meanwhile, WHO had taken that message to say, okay, no hydroxy. Samina says, please invite Chinese scientists to talk on how they control it. Samina, do you feel that they are, if they controlled it, I don't think they would tell us. Here is why. And so please, my Chinese friends, I have so many Chinese friends. There are, if they were going to tell us, let's say they have an antidote. Let's say some magically in China, they're able to control it. They have some antidote, they knew what the virus was, and they're using it. Let's say that's the conspiracy theory. If that was the case, then till to date, they have not shared it. Why would they share it now? In my opinion, either they're not reporting the data, or they really have a control that is beyond the rest of the world's understanding. So you're correct in saying to invite someone. I do not know if someone from there will be willing to talk about it, but it's a good idea. So ColombianCoffeeBeen says, if 2DG was ineffective on tumors, do we know for sure the mechanism is energy deprivation? So that is a thing. Not only ineffective, there was some effectiveness as well, which we did not understand, that why did it do it if it was just the energy modulation. So you're correct, and it says the literature about 2DG says we still do not understand the molecule very well and how would it work. Just like Ivermectin, people thought it is antiparasitic, and here it is working for some viruses as well. So it's just a molecule and it can do more things. Good comment. JLB says, question, UK is suggesting males less 40 years. Yes, that give males less 40, yes, that gave birth few months ago. And so females, hopefully, right? Or in UK, there are males who are, okay, months ago and breastfeeding and take first dose of Astra, that they took Pfizer as second dose. That's very interesting. So have they started coming back with this mix and match messaging? I did not see this. So if I can read it correctly, what you're saying is that UK is saying that the females who are breastfeeding and who had taken AstraZeneca as a first dose can now take Pfizer. And the difference is that AstraZeneca was adenovirus based and probably possibility of clotting in women under a specific age. And then they can go to Pfizer, which is messenger RNA based. So that's very interesting. I would love to see that data and then share it here. So test rat says, disturbing that any vaccine would cause this with your wife. Inflammation of a month later is a problem. For the vaccines, the antibody production can continue, just like with the infection, for 2 to 3 months and then decline. So the important thing to figure out is it really the vaccine? Is it the antibodies which are still out there, or inflammation, or it is something else? But to me, it seems like vaccine related. Denise says, please tell me you're having her do full BID mast cell protocol. No, I haven't started yet because Elizabeth says, have you considered prescribing her steroids? Might it make the vaccine less effective and yet rid her of pain? Actually, I feel that steroids would really help, but her doctor is not there yet. They are trying various anti-inflammatories. Shayan says, you're a doctor and a teacher, two professions that need caring people, and you well deserve to be both. Thank you very much. Thank you. Jagdeep Singh says, Dr. Bean, if COVID uses glucose in the body for energy, what happens if you shift to a diet like keto where body is working on ketones? So let me back up and say this. Virus just needs the cell to work, whatever is the fuel type being used. So if somebody is running on ketones, eventually what happens is now you're not using glucose and you're using ketones, but you're still offering cells some fuel that they can use to work. So as long as cells have fuels to work with, virus is going to use that fuel to operate the machinery and work. So it is not that virus demands the glucose only, it is just that they need the cells to function. Here they are specifically trying to reduce a cellular function. So for example, if there is a patient who is on ketones and they don't really care much for the glucose and you give them this one, then it would not be very useful. I'm just joking now. JLB says, UK suggested that to my daughter. She called me today. That is very, very interesting. So the good news in here is they are saying, fine, AstraZeneca, age below this age, possibility of clotting, so move away from this and use Pfizer. That is what I wanted in the US. I wanted in the US, instead of saying we are lifting the ban, and I was very angry when I saw that the statement by the committee representative was that we did not decide to say don't give it to women under a certain age because it will be hard to explain. I was very mad about that you are so lazy that you cannot try to explain and just risking people. So that is what I wanted here in the US as well, for us to come back and say, you know what, Johnson & Johnson, women 40, 50 years of age and below, do not use it. Done. You have Pfizer, you have Moderna. Unfortunately, the rest of the world is stuck. US has ample medication available. Anyways, so I'll go on a rant, I'll stop. Doug, you have kept a very keen eye on the whole, all the chats. So my jaw is fine. It had inflamed after the first dose. Then about 20 days later, it became inflamed again. Then after the second dose, it was inflamed tiny bit. And then it just, I have recovered. So I do not have that. So there was 3 phases. First dose and a few days after. About a week, whole week, I could not open my mouth. Then about 20 days later, there was another pulse. And then after the second dose. But after the second dose was less. xbluebells says, what does Dr. Bean think about the future of the US and COVID? Is it pretty well completed for us? I think that the COVID is almost now on the way out in the US. Same for UK, same for Israel, same for so many other countries as well. Kevin says, is Ivermectin proven to work with long haul, and is the dosage 18 milligram for 5 days protocol safe? So 5 days, 10 days, I have used it for my patients a lot of time. So I think continuous usage for 5-10 days, I have done it. It's fine. The dosage I've used is 0.15 to 0.2. Lately, I've been using 0.4, and that has been working as well. Now, proven for long haul. I was actually this morning discussing this as well. I had done this discussion a few days ago as well as a discussion for Cool Beans here. And I was, when I was talking with this gentleman this morning, here is how to think about this. Imagine if we have the primary pathology is that the immune cells, when they worked and overworked and continuously worked, they had certain genes that were expressing in them during the infection. And those gene expressions are now continuing in the newer cells as well, even when the virus is not there. This is called virus known phenomena. And so virus hit and run, virus is gone. It has just hit the immune system, and the immune system is now going mad, and it is just continuing to produce cytokines. If this is the situation, steroids would work. Other things will not work. Or other things would help. For example, if you take anti-inflammatory, that would help because it would reduce the clinical outcomes of it, but the underlying basic machinery that is faulting would not be corrected. Steroids would help here. Tocilizumab would help here. Then let's say this is not the mechanism, but the mechanism is that in some people, for example, Dr. Bruce Patterson says that in the monocytes, he has seen that there may be viral proteins or spike proteins sticking in there. And then as the monocytes replicate, as they become duplicated, like a photocopy, every piece of material in them is duplicated as well. And so that means some viral debris, the zombie virus, I meant to share that paper with you that Dr. Paul Marik shared with me, which is that there are zombie viruses. That is, the virus doesn't have RNA, it just has the body and the spike proteins and nothing else. And they're just sitting in cells. So if that kind of a zombie virus or some viral proteins are sitting in here, then what would happen is that the immune system would continuously produce the cytokines and react to this virus, trying to clear it out. If this is the case, ivermectin would help, because ivermectin is going to try to work with the spike proteins in the virus and to kind of reduce the duplications. If this is the case, vaccine can help as well, because the vaccine is going to generate antibodies that are going to get into the face of these spike proteins and reduce the action. Now, let's say this is also not the case, or maybe this is a combination of all of these pathologies. Then let's say it is really the mast cells where the antibodies have now gotten loaded and the mast cells have become upset. So it is a mast cell activation syndrome. Then antihistamines would help. Mast cell stabilizers would help, and so on. In this case, in the middle case, NK cell optimizers would help as well. So for example, yoga, for example, going to forest, for example, relaxing, being happy, all of those things would improve NK cells. That would then help these cells. So that is also possible. If it is macrophage activation syndrome, instead of a mast cell, macrophage activation syndrome or MAS, then once again, steroids would help. The tocilizumab-like things would help. Interleukin blockers would help. So, and it seems to me, after talking with various long haulers and seeing the solutions, it seems to me that there may be combinations. That means solving for long hauling is not just give this drug and this should work. Solving for long hauling would be to try an algorithm to say, for example, in addition to this, we have a cool bean here who said that I got IVIG and I'm feeling better. There is another cool bean who said I got interferons and I'm feeling better. So the algorithm is going to be something like this, that when the patient arrives, you start with, let's say, steroid plus ivermectin, and then go on with this for a month. And in this process, try high dose ivermectin and then low dose ivermectin. One steroid, try regular steroid therapy. So with this, what you're doing is you're attacking the first two parts. Then stop them one by one. Stop the steroid and not ivermectin, and see how patient is doing. And then later on, stop ivermectin and see how the patient is doing. If the patient has gotten the issue again, then try with antihistamines. If that comes back as well and improves, then try the next thing. Or does not improve, then try the next thing. For example, fluvoxamine in some people have helped a lot. In some people, it has not. So for the long haulers, I just have one good news, and that is, so far, any long hauler I've talked, they say that with the passage of time, and the passage of time is slow, year, for example, right now, with the passage of time, they continue to improve. So it is not that they would not improve, they continue to improve. It is a very slow recovery. So Skyfrog says, how's your friend's mother doing? So she is still stable in the same state, which I credit to drugs like Ivermectin. Hospital is still being stubborn. The problem at this time is that she has stopped eating. And my friend, because he himself is a doctor, he said to hospital that it is really important that she continues to eat. And she's conscious, so she's just refusing to eat. She doesn't have appetite. And so he said, even if we have to give her parenteral, nutrition, continue to give her nutrition. And hospital has refused that as well. So I'm sure that they're going to try something that would stimulate her appetite, and then they're going to try to see she eats. But it just looks like a hospital is just stubborn now. And that is a problem I'm seeing. I was talking with him last night as well. That is a problem I'm seeing with the doctors at this time. That if you try to tell them what to do because you have some knowledge from somewhere, once they become upset, they would then drag their foot and not do the right thing on every step of the management, which is very, very dangerous. Rajiv says, since there is no difference in the first and second doses of vaccination, can we take COVID vaccination more than twice? Is there a benefit or side effect? Good question. I think that we haven't seen the data for that. In general, if I just look at the science part of it, no, it should not matter. The third dose would cause immune system to go even more mad and produce even more antibodies and more B cells, and maybe there may be more intense side effects. But still, for the body, it is just another infection that came back once more, and body has to fight with it. So body would not just keep becoming mad about it. So third dose should not. And that is what happened. Remember, I shared a study in which they said people who had COVID, we tried first dose and second dose. So imagine, take COVID as first and second dose. COVID itself is a huge deal. It is not just a first dose, it is first, second dose together. Then give one vaccine dose, that is a third dose. Then give the other vaccine dose, that's a fourth dose. And they saw that with the first vaccine dose, there was some improvement in the antibody production. With the second vaccine dose, there was nothing. So I think that is what I would expect with the third vaccine dose. Aruj says, hi, Dr. Bean. It would be great if you could have a session on a day-by-day COVID management protocol, what to do, watch out for, tests to take. Many hospitals doing this to help people suffering at home. I can definitely do that. Maybe. Okay. So let me figure this out, that how to do it, and I'll start doing it. Shawna Johanson says, 4-member band exposed to COVID, all tested positive, 3 moderate symptoms, but 4th no symptoms. He took doxycycline for tick bite 2 weeks before exposure. Doxy offers prophylaxis protection too. How? So Shawna, sorry, I said Sean. So Shawna, I'm sorry, I do not know if doxy itself is useful. We know that people can have asymptomatic, or there are people who are caregivers to the people who have COVID, and the caregivers don't have COVID. So it is not necessary that everybody should have COVID. Now, this may be a chance that they had doxycycline and they just said maybe it is doxycycline, or there may be something, I just am not aware of it. David, thank you very much for the super chat. Rizobit says, if zombie virus exists, then why not zombie vaccine bits? Very good one. Good. Is this even tested when vaccine makers only want to deny any potential problems? So by any chance, are you anti-vax or not? So good question. So your previous question was useful as well. This is a good question as well. So let's talk about this. Very simple. When an infection is causing zombies, remember that these are being built somewhere, right? So what is happening is, how are these zombies coming together? This is like a baby is forming, but the brain is not forming. And why is that happening? That is happening because inside the cell, there is this virus being built. And in this virus, we are going to stick a messenger RNA at the end of it. And if we fail to stick the messenger RNA, then this will become a zombie virus. Now, if this zombie virus is sitting in some cell and that cell is proliferating, for example, let's say, I'm going to use an example. This is not true, but an example. Let's say the SARS-CoV-2 is sitting in a B cell. And now B cell is proliferating, meaning dividing. Then whatever zombies are in there would divide with it. Now, take that to the vaccine. So let's say there is a B cell who picked up the vaccine and from the vaccine made the spike proteins. And now B cell is proliferating. Yes, it would proliferate the spike protein with it. Eventually, it's going to break it down and show it outside. Now, why are these things not broken down? I think the reason only is vaccine is 5 milliliter, in which there is a very tiny amount of the actual dose. Here we have a virus that ran through the respiratory system, upper airways, lower airways, and it just was everywhere. That has a very different scale than the vaccine. But you're correct that from a theoretical point of view, from a mechanism point of view, you could say that whatever duplicates the zombies would duplicate the spikes as well. Although the spikes are going to be really low, number one. Number two, our immune system so far is known to just shred them and present them. So we'll get rid of the spikes. Good question. Rubaga says very itchy today. Is that because of the vaccine or some other? I remember that you had taken a vaccine. So somebody said to me, Chand Raat Mubarak. So thank you very much. I just saw this and then the comment. So Chand Raat Mubarak means, so what happens is the Eid is declared with the moon. So when in the evening you look at the moon and you say, okay, tomorrow is Eid, then that is called the evening or the night of the moon. Okay, so let's answer a couple of more questions. And thank you very much for super chats. If there are questions, I'm going to go and answer them. Alex, you said that spike protein is getting crushed inside a cell. How can a virus that assembles itself from many proteins there and leave the cell? Why these parts are not being destroyed? Very good question. See, so this is why I love Cool Beans. We think aloud and we think together. So here is what happens. In a cell, which is virus infected, in this cell, the virus comes over and starts taking over the machinery. In the beginning, when the interferons are present, virus is actually defeated by our cells. That is why it takes some days for it to kind of build up, because our cells are going to pick up this virus and start shredding it, because they think it's a foreign antigen, and they would start presenting it. That is why we develop fever and we develop immune system reaction and eventually control the virus. If we were not shredding and presenting, then our immune system would never become active and we would never develop fever. We would never develop side effects of the virus. We would never actually control the virus. That would be like we are immunosuppressed. Problem only is this virus, and now especially the variants, they just divide so fast that even when we are presenting it, meanwhile, there are viruses that are ejecting from the cell. Virus knows how to eject. Why? Do you know why the virus knows how to eject? Because it has an envelope on it. It has a lipid nanoparticle on it, and it uses that to get out of the cell. Spike proteins have no lipid nanoparticles on them. They cannot get out of the cell. They're trapped inside. Virus knows how to pinch off the vesicle membrane from Golgi apparatus or from the other vesicles and then get out of the cell. So virus is just getting out. So the cell is presenting the virus. An immune system is acting, but the virus went out, it went to the other cells and did the same thing. That poor cell also tried to present it, but meanwhile it went to the next one, and that is how it does. Now, in some people, their immune system would very quickly catch it and destroy it, and they would not even know that it happened, asymptomatic. In some people, milder infections, majority of them. And then some people are not that fortunate, where it would just cause so much destruction, an immune system would become participant in destruction instead of helping. Very good question. Okay, so William Goff says, question, if a normal intramuscular injection usually takes 30 minutes before it hits the bloodstream, do you think some of the mRNA vaccine could be making its way in the bloodstream first and then entering into the cells? I don't think so that it would go there first, because this is wrapped in a lipid nanoparticle. So the first priority will be for the cells to pick it up. There would be some that would slip out, but majority would be picked up by the cells. So I'm going to just quickly see the questions here. Aruj says, thanks so much. Really looking forward to your sessions on COVID management. Will do. You know, these sessions I have to... Texas says, Texas, thank you for the super chat. You're quitting early tonight. Yes, there are questions. So whenever I see questions, I wish that I can answer as many as I can. So, so there is another. Alkam says, Dr. Bean, I got COVID in December. I still have not gained my sense of smell. My kitchen had a gas leak and I didn't know, will I regain my smell? So Nadir, sorry about this. I have seen this happening this morning when I was speaking with the long hauler. He also has not gained sense of smell fully back in 1 year. So he said that, hey, I have some bitter taste, metallic taste in my mouth all the time. And he said, I feel weird smells for certain things. And that was because his sense of smell was still not back. So I'm seeing long haulers with the sense of smell. In the beginning, no smell, then return of the smell, and then phantom smells, which is incorrect smells. However, I have also seen high-dose ivermectin very quickly helps to restore smell. Fluvoxamine can also very quickly help to restore smell. So if you talk with your doctor and see if you can get high-dose ivermectin or fluvoxamine one by one, don't take them together so we can see which one is working. And then with their advice and help, I think it can be helped. Aliji says, have you plans to visit London in near future? So I'll tell you something. The gentleman I was talking with, young man, I was talking with this morning, he's in London, he's a long hauler, and the problem is in England, they're not getting medicines and doctors are not really agreeing. And he was in such a dire state that I was actually saying to him, I said, you know what, I'm going to go to a different country, I'm going to get medicines and bring them over to you. So because of that, I was getting ready in the morning to say, all right, next month I'm planning to go out for about a couple of weeks. So I was thinking on the way back, I'll go to England as well. So Aliji, I have a plan. I do not know if I'll be able to fully activate that plan or not. But I want to travel next month for a couple of weeks. I will, during that time, I would try to do my best to keep up with these sessions as well. But that is what I have in mind. So that is hopefully, if that is the case, I would probably come over to London as well. So R. Geezer says, would one who had COVID have antibodies to the second spike protein? Who had COVID have antibodies to the second S2, okay, protein and have protection against all coronaviruses? That is what the Japanese researchers are trying to do with their super vaccine. So first of all, they are actually American researchers. They borrowed the cells from the Japanese university. So the credit goes to American researchers for this super vaccine we talked about. So that is one. Second, the when there is a COVID infection, the spike protein has both parts always attached to the coronavirus, right? So the coronavirus has S2 part and S1 part, S1 part. So let's say this is the S1 part and that has receptor binding domain, and this is the S2 part and that has the fusion protein in it. So ideally, the spike proteins, antibodies are generated against those. And there was a cool bean who had a very good question at that time as well, that if we are making spike protein antibodies against this part, then why do we need a separate fusion protein based vaccine? This current system, infection or vaccine, should work. And she was correct. And I don't have an answer for that, because if our current spike protein and we are making antibodies against it, then we should probably make antibodies against fusion protein as well. The only reason we may not make fusion protein is that if our antibodies are just binding to other epitopes and not on this one. So if the super vaccine comes back and just creates that one tiny part of the fusion protein and forces the immune system to just look at that one and make antibodies for that, maybe that would help. Otherwise, you're correct in your basic mechanism, but it looks like these are not doing it. So any reported cases of blood clots after second dose of AstraZeneca? I know about, I have to look at the data, Aliji. I would think that there would be, but without data, I cannot tell you more, less, or the same. Jamili Zal says, Dr. Bean, will Pfizer be effective against Indian variants? Yes. So Pfizer is messenger RNA based vaccine, and yes, it would be fine. Actually, Israel actually saw that it worked fine. Cool. Kevin said, question, Ivermectin has helped me with COVID gut and I'm able to eat again. I'm left with some head pressure, dizziness, hypersensitivity. Is there anything shown to help with this one? Quercetin, more than quercetin, fluvoxamine and the neck massage and the spinal cord pumping. People have reached out so many times to say that just this neck massage and moving the spinal cord has helped me a lot. And then fluvoxamine has shown to be very helpful. Antihistamines have shown to be very helpful. So in addition to ivermectin, I believe that in theory, the next things to test with your doctor's approval will be fluvoxamine and antihistamines. Cool. So let's stop for now. Tomorrow and day after morning, I will not be conducting sessions because it would just be Eid. In the evening, I'll try that I do sessions tomorrow. If at all I missed one, that would be on Friday. So with this, thank you very much. Please like, subscribe, and share. If you can just like it, that would be great enough as well. And if you would like to support this work, then there are 3 links in the description. One is to buy me a coffee. The other one is to be a patron. And the third one is to use PayPal to support this work. Thank you very much. And I would see you tomorrow evening. And happy Eid to everyone.